I think it's a good plan because since I've left larger companies, this one is small. It has about 62 employees. About half of them work in the field because they do outdoor living design, hardscaping, landscaping, and it's an award-winning company. They have a niche that they're recognized for in this part of North Carolina in the country, and they're very upscale. And so for the hourly folks, it's perfect because you'll get a lot of them at all ages that just cannot afford health insurance, even if they're going through healthcare.gov. Yeah, you can buy a cheap plan, but the plan isn't worth anything. It won't do anything for you. So this is really, I think it's been appreciated by that particular group and their children or their dependents or partners or whatever, because it's it's there for you. I always remind everyone I've hired about 4 people this week, and I give them a pamphlet and I remind them this is just a benefit we're throwing out to you as a full-time employee. And they're shocked. Like, there's no catch to this. No, we won't take anything out of your paycheck. So even the salary folks like it because, if you have a lot of kids and little things happen, sometimes it's quicker to get to a teledoc and it's not a major issue, but you might need an ointment or a cream or something. Somebody has a little cut and it's great. It's no expense to them.
It sounds like the hourly staff have actually, it's been a boon to helping you take care of the hourly staff with the free primary care. How overall is the experience post-merger been?
A lot of the salaried people have started signing up for it too. I mean, I noticed a woman who's she's about 62 and she signed up for it. She said, no, for the small things, I find it very helpful. So yeah, no problems with it. The dashboard's good, the billing work, adding people, taking them off. It's very user friendly, very simple. It works.
And going back a bit, why did you choose LifeRaft at the very beginning? I know ICHRA is a new innovative plan design. I'm curious what your process had been and why the company initially selected LifeRaft.
If it was really just for compliance reasons. One of the reasons I took on this company is they're very well known in my area. They're very upscale. It's a young group of people running it. They're very clever. They're very creative. My CEO is very good in terms of design, specs, technicalities, project coordination, because there's so much that goes into all this stuff. And he's not a reactionary, so he's good at listening. He said to me, I need somebody like you to come in who knows it left, right, and center and tell us what we need to do and what we're not doing. Are we in trouble here? So there were several areas that were serious issues for such a small company. But one of them was they were not compliant with the IRS, right? They're over 50 employees full-time or the equivalent, and you have to either offer a plan that's affordable or you offer the health reimbursement account. It was just that simple. So the owner, who is not the CEO, made it clear to me that it had to be reasonable fees, because when I broke it down very clearly in the presentation, he could see overhead wasn't so bad, but the more people that joined, he was concerned about cost per head. And I said, well, the more that joins, the better for us, no matter what plan we're in. It's better for the employee because then they're definitely going to maintain medical insurance rather than trying to, tweak it and say it's workers' compensation. I got hurt on the job, that type of thing. So we don't want it going that route either. And so we shopped around. We looked at one other plan, and the broker had recommended this one. And it just seemed more straightforward and easier to deal with in terms of the dashboard, the billing and everything. I think easier to get people signed up when they were eligible and for them to understand what it was, because they were very distrusting of it. Even salary folks are like, I don't know why they distrust it. I think it's because it's too easy. You're getting a pre-tax reimbursement in some cases if you qualify, and it just seemed like, this doesn't make any sense. You're not taking my money. You're going to give it back to me.
That is quite humorous because it's new and a different way of and with the ICHRA itself, it sounds like it's very. So my mom runs part of what inspired. My mom runs a small business, and when they hit 50 employees, very similar. It's like, whoa. and they have a mix of office staff and hourly folks. And so it was a finding a plan that could, ensure they were ACA compliant, but also that they could meet the needs of the two groups of employees was an interesting pursuit. But with ICHRA, it's so different than traditional group plans. How did you get comfortable with ICHRA? Were you already aware with
I was
that?
already familiar with it because my background is basically a generalist. So, I've always had my hand in benefits as part of Total Rewards. And at one point I had been in benefits. So it's certainly compliance is not foreign to me, Joseph. Employment law and compliance are probably two of my top 5 interests and strengths in HR. It was funny. I had one gentleman and he refused to sign up. I said, well, sit here with me. We'll use my laptop and we'll get. He said, I'm not doing this. There's some catch to this. He was Southern and he was very suspicious. I was like, there is no catch to this, Mike. You're losing money. You're throwing money away. So then he came back to me 2 months ago and he said, Maureen, I'm taking you off on your offer, an open enrollment. I'm coming to your office and you're going to help me. I should have done this, like you said.
But so how did you come to learn about ICHRA? What made you explore it for this particular company versus just sticking with a traditional group plan?
Right. I mean, how I know about it is just like I know if you have 100 or more and you're a government contractor or subcontractor, you file a EO1 report. It's all compliant,
Yeah, I
right?
see.
Even though in my large British company, 300,000 people in North America, I admit I didn't have to get that much in the weeds, but you still had to know it. You had to be up to date, etc. I had first looked at plans and said to my CEO, I said, look, I'm going to do my due diligence and be fair to you here, and I will take the time to talk to, for example, in North Carolina, Blue Cross Blue Shield of North Carolina, that's the biggest one here, and a couple of other insurance carriers. But I said, really, it's a futile effort because I assure you it's going to be unaffordable for us, unaffordable to the employee, and you have to guarantee a certain number of people for that rate they contract at. If it drops, we're so small. I've seen this happen where they just drop the plan. They give you a
Right.
warning, of course, or the rates are so high, everybody drops out of it. So I did that and presented it just so he and the owner could see it was not feasible. There was nothing out there. And apparently in North Carolina in the last few years, they did have some provision at state level for small businesses, and they got rid of that. That would have helped with small business marketplace insurance. So they've thrown these small businesses, and there's so many of them in North Carolina. It's still not a corporate environment here. There are bigger companies coming in. GE has come into aerospace has come into Wilmington, and there are people moving in, but you'll still find a tremendous amount of small businesses there. And so you're really out on your own. Go figure it out for yourself.
My parents, they had a United group plan, small group plan, and 2 years ago it was just kicked off. It's like,
Yeah.
oops, my
Mhm.
sister, who works for my parents, was pregnant. Was 8 months pregnant. She'd
Oh, no.
scheduled the visit, the C-section, and she was scrambling to figure out what do I do. And luckily, that was actually when I initially learned about ICHRA. It
Yeah.
solved the problem in a way that they don't have to worry about getting kicked off. So it sounds like for the salary staff and employees, even though it was a new thing, some really loved it because it was they get the pre-tax reimbursement. Those that were somewhat hesitant or apprehensive got around to once they learned more, they got along, they came around. On the plans available in the individual exchange, have you had any issues or challenges now that employees have had it for about a year?
None, not at all. Not a single complaint. Yeah, it's a real conundrum because Sherm just put something out yesterday in our daily newsletter saying that, the medium and large companies, they refrain from using the word corporation, but that's what they're talking about, are predicting next year rather than the percentage increase they thought they would see for healthcare costs, primarily the medical insurance. They're predicting it could go as high as 10% in some markets. And Zembic and all these drugs that people are using rather than diet and exercising, and I'm not criticizing anyone, but rather than trying something healthier first, they're going for these shots. A lot of them have been subsidized by the employers, and the employers can't carry it anymore. They can't afford that. So they're going to probably have to pull back from that a bit to do something about the increases next year. I mean, we're in a quandary here. I come from Ireland, and, you know, it's like England and Canada. They complain about the social welfare system. It worked fine for me, and I'm, apart from the allergies this week, which I don't take medication for, I have no health conditions. And I take vitamin C and I take a calcium, and I exercise a lot. And I think part of it is how you grow up. If you're fortunate enough to grow up with the right type of food, the right type of diet, it carries you into later life. But even the new health secretary, whether you like him or not, said the other night, I heard him, and I thought it was spot on. He said, look, in this country, everybody thinks there's a pill for everything. There is, but as my father would say, he was a doctor, you know, the pill I give you to help your heart is going to damage your kidney. So, you know, there's always a consequence. So people are constantly at the doctor. It's like I went to the bank at lunchtime today, and there's a medical building next to it. If I couldn't believe it, the parking lot was full. I was like, oh my God, what are all these people doing in there? You know, it's like the healthcare system is overburdened. So I'm shocked that our cost of insurance hasn't gone like car and homeowner insurance. At least in North Carolina, it's gone through the roof, but I think that's the case everywhere in the country now.
Because if you have a high deductible, it's like you're basically uninsured until you use up your deductible, or you're uninsured because you can't afford the premiums. But the thing that suffers is preventative care. And if you invest in preventative care, even though you might not see the results today, you'll have a longer, healthier lifespan. But investing in primary care is oftentimes, in most plan designs, difficult to get access to. Appointments take a month. It's just more complex than it probably needs to be. And our kind of part of why we have the primary care membership, in addition to now the ICHRA, is that we want to make it easier for everyone to have access to high quality primary care, so that they can get the issue taken care of. They can have mental health provider or nutritionist help them with the basics of how do you live how do you change behavior so that you can decrease the likelihood that you develop any chronic conditions. And our medical providers often say this, but the easiest thing would be for us to prescribe more, but success shouldn't be measured on how often we prescribe medication, but more on how do we help our members change behavior. But that's certainly the harder way to do it. It's easier way long term, but harder way to probably swallow in the short term.
Yeah. I agree with you. And I've had doctors say it to me, there's no focus on primary care. They want to treat you when you've already arrived down that road. There's things they don't want to do as a preventative test or to check it out or whatever. And one thing I've learned coming from the New York area 12 years ago, where there was less of the healthcare corporation, well, that's all you have in North Carolina. And doctors are typically told 20 minutes with a patient. As a matter of fact, I was going to the dermatologist. I took too much sun over the years, and I thought, okay, I think there's a couple of spots here. I just want to have them checked. And I had to go to the primary care to get the referral. And when the appointment came in on my phone, maybe I never noticed this before, Joseph. It actually said 20 minutes. And I had been told that, and this is an office visit, and I'd been told that several years ago when I came down here by a doctor who was a resident for one of my husband's doctors up in the New York area by coincidence. And he left and he went out with 3 other specialists and did concierge kind of service in Charlotte. He says, I just won't put up with this. You're not telling me how long I need to speak to the patient. I may have this patient with me for 10 years, but I may only see them once a year or twice a year. 20 minutes is not enough.
What's interesting is, even though they put 20 minutes down, the average primary care visit is actually less than 9 minutes. And most of that time they're looking at the form, filling out it's like, what's your issue and how can I write you a piece of paper so you can go. It's just so impersonal. And like, even with technology, it's just the thing that I think what we've seen is that relationship with someone that cares for you and that you feel you could, that's the beginning of any behavior change. And so many people describe going to countless providers because no one listens to them, and then they finally have someone that listens, and they discover the root cause. Instead of nothing's wrong with you, they treat the symptom but not the root cause. But I think that our our aspiration is to play a meaningful part in helping to change that. But I think the only way to do so in our is shifting away from the fee for service billing for every visit that you have, because it'll just incentivize compressing the number of minutes that you're spending with everyone so you can make more money. And it's not really a relationship. Say, come back so I could give you a flu test and I can make more money. It's just the incentives are misaligned, and the insurance company is a customer. The patient is just the way to juice up the profits.
But at the end of the day, without getting into anything political, there's nobody managing the insurance industry. That's the real problem at the federal level, where it's like, to your point, this is what's happening. We all know this. But if you don't provide the right incentive to the insurance industry with healthcare, it's not going to change, because many of them are there for profit, and they're not hiding that.
I can't imagine if you were building the system from scratch that you design it this way, because it's insurance company first, not patient first, which is kind of backwards in my opinion. But I really appreciate you making time to speak with me. This has been quite a refreshing conversation. Is there anything that we could do to help make your life easier, help you better take care of your employees?
It's going very well, Joseph. As I said, I like the pamphlets because I can keep them on my desk. I can put them on employee boards. I hand them to new hires. Sometimes when somebody tells me something happened at home, I'll say, here's the flyer. Don't forget this benefit. You have it until next May and it costs you $0. So it works very well. It's very easy to get in there, as I said, and just do the admin work. And personally, it couldn't be simpler and more user-friendly when you're looking at the dashboard.
Amazing. If you're ever doing any wellness days, we're eager to do either with the content or other creative things that you might want to do. Intention is to be here and to help you better take care of your employees in any meaningful way. We're here to try to be as creative as possible.
Keep that in mind. My challenge always is offering something when the bulk of people on a good day, good weather-wise, will be out in the field. There's only a few of us that may be in the office, so even if it's required training, that presents a problem. I mean, there's always something you'd like to be able to present on the health scene, whether it's on the mental health scene, the physical health scene. But putting that together for employees is tough. Asking them to, something that might be of interest is offering a webinar that could be offered maybe later in the day or after 4 or 5 p.m. Eastern, that people if they so choose, could join in on. And the topic could be whatever it is: stress, anxiety, weight loss, I don't know, navigating the healthcare system, something that, might be useful, where some people, small group, could maybe use the Q&A for a couple of questions, and you pick the 3 or 4 questions that are really worth responding to the group, that type of thing.
That's a great idea. I know we've done something similar to one of our companies is a senior care company, and they have field workers mostly. So coming into the office is tough, and we helped the HR leader put together a virtual program for those employees that were interested. That's quite interesting.
That sounds good.
Awesome. Thank you so much. I hope you enjoy the remainder of your week, and like the allergies get.
Thank you. Enjoyed speaking with you.
Thank you so much. Talk soon.